Let's turn now to coronavirus in the United States. It's now risen to more than 15.4 million cases, positive cases of the virus in the US. And the death count has also ticked upward to nearly 290,000 deaths. That's all according to the Johns Hopkins University COVID-19 tracker. Yesterday, we saw a record number of deaths. More than 3,100 people died from the deadly virus. So let's bring on Dr. Nada Fadul, Associate Professor of Infectious Diseases at the University of Nebraska Medical Center. Doctor, so we're seeing cases rise, we're seeing these death counts rise. How much longer do you think that this virus is going to be a runaway train?
Yes, thank you for having me. Unfortunately, these numbers and high mortality that we're witnessing right now is not surprising. There's so many factors that contribute to this. Some of them are out of our control, such as the weather, but there are some factors that we have control over, whether that is citizen responsibility, whether that's federal responsibility of having a nationally coordinated response to combat this pandemic. We're seeing variable responses across states, and that's really augmenting the problem that we're seeing right now. Many states did not implement directive health measures that will combat the spread of this virus. And with the travel and the spread that we've seen through Thanksgiving holiday, unfortunately, this will continue as we face a similar pattern during the next holidays.
What about restrictions? I'm wondering if you think that we're doing them properly. A lot of folks are saying we should not be closing schools and allowing restaurants to be open. So, what should we be shutting down? What should we allow to stay open? And do you think that states need to be more restrictive on what activities are allowed to remain operational?
I think there are many evidence-based strategies that we know are very effective in combating the spread of this virus. We know masks do work to halt the spread, so states really need to take that seriously of implementing statewide mask mandates that will hopefully restrict the spread, but also unnecessary gatherings need to be taken into account. Many states have open restaurants, open places, public places. They don't have restrictions of the gathering numbers in these places. So that also needs to be taken into consideration. And unless we have a federally coordinated national response that takes into account making sure all the states, follow this national response, then we're going to see this variability because there is movement between these states. People are traveling; they're going to continue to travel, and unfortunately, that's going to need to lead to widespread spread during the holidays as well.
So we do have this vaccine candidate from Pfizer. It's looking to be analyzed today, scrutinized by the FDA in advance of receiving, hopefully, an emergency use authorization. I'm wondering if you're scheduled to take the vaccine as yet, and what are some of your biggest concerns about this vaccine right now?
Well, we're all anxiously awaiting the decision from the FDA. We're really hoping for an emergency use authorization of the vaccine, but there are many concerns that need to be taken into consideration when the vaccine is made available. So first of all, we know there are not going to be enough doses, especially for high-risk people, including healthcare workers, including essential workers, including older adults, those with high-risk conditions. There are only going to be 2.9 million doses available right after the authorization, and that's just not enough. And we don't really expect manufacturing to be able to keep up with the numbers of patients who need to be vaccinated. So that's one of the concerns that we need to keep in mind. This is not going to be an immediate solution to halting the spread. The other big concern that many of us have in healthcare is that we really need to make sure we have effective ways to make sure we reach minority populations who have been highly impacted by this pandemic, such as African Americans, Latinx, Native Americans, who have almost 3 times the risk of death of this virus. And we need to build trust in those communities in order to ensure uptake of the vaccine. And that's really need to be taken into consideration. It's just not the authorization, but also the distribution and the equitable access to the vaccine. There's also the concern that this is going to give a false sense of security to the public, knowing that there is a vaccine. We know that it's going to take months before we reach the majority of the population. This is not going to be something that's done overnight. We're expecting by February, we're only going to reach 30% of the US population. We really need to
Right.
reach a
So
much
folks
higher
still need to
threshold.
make sure they maintain social distancing and keep those restrictions in place before everyone gets a vaccine. All right, Dr. Nada Fadul, University of Nebraska Medical Center. Thanks so much for joining us.
Thank you for having me.